Welcome to Inside Learning Forum 2024. It's my honor to stand here before you as the moderator of this conversation. My name is Tijesu Ojumu, and I'm very privileged and happy to be here.
This is a convening of strategic minds towards reshaping the public health scene in Nigeria. What we have done is bring together experts, practitioners, and policymakers to share ideas, share knowledge, forge connections, and most importantly, inspire innovation. The plan is for us to take those learnings from here and then actually make the change that we want to see. Thank you so much once again, and I hope that you enjoy the rest of today and this event will bring value to you.
And it's very nice that we're having new persons, join us on this particular digital health cruise to really drive an agenda. And we're to hear some of those conversations this morning.
It's cultural sensitivity and inclusivity that actually supports user adoption. And that's where private sector partnership comes in, because we have an agreement with Airtel to give free airtime. They were able to call the platform at no cost. They were also able to speak and listen in their preferred languages. I think that was the singular reason for the success of that implementation.
But my question with regards to the blockchain framework is there any use case for blockchain for interoperability right now anywhere in the world?
The kind of stakeholders we have here are the kind of networks that I require to take one click to the next level. So top of my list is network, and then second, of course, is to learn.
It's always great to be in a room with like minds discussing digital health and, as a segue, innovation and improvement within the digital health space. So I've learned a lot. I've met a lot of new partners, potentially, knock wood, and I have a lot of takeaways, that I hope will improve my own implementation of digital health at my facility.
We need to move away from talking to implementation. But I also recognize that talking is a form of advocacy, because you always learn new things when you come to this kind of gatherings like I have. So it's heartwarming for me. I've had a chance to interact with NITDA, and hopefully we can engage them more. But really our support should be around understanding what is already happening in the environment and then finding a way to scale it.
With our doctor to patient ratio, digital health in Nigeria is a no-brainer. We cannot access all these patients with the current patient-to-doctor ratio. So that's one of the things, right? It's not even, it's a nice to have. It is the only way to democratize health in some way.
What we need to take away from this forum is that we need knowledge to move the needle on the problem we face in Africa, whether it's digitalization, interoperability. If we do not have knowledge, we are not going anywhere. We have seen for decades funding for different systems, and those funding come and go and they come in millions, and yet still the problem remains. So the only way is for us to have capacity locally to design, use, and then maintain these systems when they get deployed.
I immediately expect from the government side to look into whatever is being recommended here that will come out as either a communique, look into it and pick those that need to be immediately implemented as the low-hanging fruit. Then draw a plan on how long-term sustainable plan can be deployed in collaboration and implemented in collaboration with the private and the public sector. The platform has provided that collaborative approach, and I think it's just a matter of identifying what is being recommended here and see to its own implementation.